my name is Komal. This is my second case study video, and I'm just going to go ahead and give you a 360 room tour. Okay, bed. Okay. Excuse me. Come on in. Hi there, how are you?
I'm good, how about you?
I'm good, thank you. So my name is Komal. I'm going to be your student registered nurse today. I will be performing a physical assessment on you. The regions of your body that I will be touching is your face, neck, and back. Is that okay?
Yeah.
Okay, so before we start the physical assessment, I'm just going to go ahead and apply some hand hygiene. And I'm also going to be cleaning my equipment, which is my stethoscope and my pen light. Before we start the physical assessment, can you just please say your full name and date of birth?
Dan Smith, September 16th, 1966, and I'm 55 years old.
Okay, thank you, Dan Smith. Can I just see your band? All right, thank you. And before we start the physical assessment, would you like to go to the bathroom, Dan?
No, I'm good.
Okay, I'm just going to give us some privacy so that we can just start. I'm just going to put it aside. Okay, so I'm going to go ahead and start off by inspecting your ears. Your ears are symmetrical in terms of alignment and shape. There's no sign of drainage, and there's minimal amount of cerumen, which indicates that it's normal. I'm going to go ahead and palpate your ears. So this is your auricle and your tragus. Do you feel any pain?
Nope.
Okay, good. Now I'm going to go ahead and perform a whisper test. I'm going to whisper some words and numbers, and I'm going to need you to relay back to me.
Mm-hmm.
Okay?
Yellow muffin 7.
Good.
Blue water 3.
Okay, perfect. So the patient is showing no hearing deficits, which does indicate that the hearing is normal. I'm going to go ahead and use my pen light and assess the nose. Can you lean your head back? Okay, so the nose is midline. There's no signs of flaring, drainage, or crusting. I'm going to go ahead and palpate your frontal and maxillary sinuses. Let me know if you feel any pain. Do you feel any pain?
Nope.
Okay, sounds good. Now I'm going to go ahead and assess your mouth, starting with your lips. Your lips are pink in color. They're hydrated. They're symmetrical. There's no signs of lesions, fissures, or swelling. Can you go ahead and smile for me? Okay, so in terms of your gums are pink in color. They're hydrated. There's no signs of swelling, bleeding, or lesions. In terms of your teeth are all present. They're fully aligned and straight, and there's no sign of looseness. Can you go ahead and open up your mouth? Okay, so can you move your tongue left, right, into the roof of your mouth? Thank you. So your tongue is pink in color. It's hydrated. It's symmetrical. There's no signs of muscle movement, or there's signs of healthy muscle movements, and there's no signs of lesions and atrophy. Okay, open up your mouth one more time. Okay, so I'm going to go ahead and look at your soft and hard palate. So your soft and hard palate are pink and healthy and hydrated. They are intact, and there's no signs of lesions. Next, I'm going to go ahead and assess your cranial nerves 9, your pharyngioglottal nerves, and your cranial nerves 10, which is your vagus nerves. So what I'm going to need you to do is I'm going to need you to take the tongue depressor, and I'm just going to need you to stick your tongue out and say ah. Okay, and thank you. And okay, so I can see that your uvula and your soft palate rises, which does indicate that your cranial nerves 9 and 10 are intact. The next assessment that I will be doing is I'm going to be testing your cranial nerves your cranial nerves 12, which is your hypoglossal nerves. So what I'm going to need you to do is I'm going to need you to stick out your tongue side to side, and I'm going to need you to say light, tight, and dynamite.
Light, tight, and dynamite.
Okay, perfect. So the patient is showing no signs of abnormalities in their speech, which is indicating that cranial nerves 12 is intact. Now I'm going to go ahead and inspect your neck. So your head position is midline. There's no signs of scars, lesions, and pulsations. Your temperature is warm, and in terms of your color throughout your body, it's consistent and it matches the genetic background of the patient. I'm going to go ahead and palpate. Do you feel any pain?
No.
Okay, so the patient is indicating no pain and no tenderness, and there's no signs of obvious enlargement of the thyroid. The temperature is warm, and there's no signs of lesions and masses. And the vertebrae is also midline and symmetrical. So next, what I will be doing is I'm going to be uh, uh, palpating your carotid artery. So what I'm going to be doing is I'm going to be counting to 15 seconds, multiplying it by 4. Okay, and your rhythm is regular, your grade strength is a +2, and I'm going to repeat this process on the other side. So 15 seconds times 4, and these findings were symmetrical bilaterally. So next, what I will be doing is I'm going to be assessing your cranial nerves 11, which is your spinal accessory nerves. What I'm going to be doing is I'm going to need you to rotate your head to one side, and I'm going to be applying resistance, and I'm going to push to the opposite direction, but don't let me. Okay, good. Thank you. Good. Now I'm going to need you to shrug your shoulders. Okay, and I'm going to apply resistance, try to push you down, but don't let me. Okay, good. So the patient is indicating that there is no abnormalities in the rotation and movements, muscle movements, which does indicate that cranial nerves 11 are intact. Now I'm going to go ahead and assess your thorax. So Ben, can you go ahead and turn around? Okay, so assessing your thorax, I can see that the thorax is symmetrical. There's no skeletal abnormalities. There's no signs of lesions, scars, and excessive moisture. And the hair is distributed evenly throughout. Okay, so Ben, I'm getting you to take a deep breath in and exhale. Do you feel any pain?
No.
Okay, so the patient feels no pain. And I'm gonna need you to also say blue moon.
Blue moon.
Okay, perfect. So you can turn around now. So the patient is definitely, the patient has the thorax is expanding symmetrically. The patient appears to have normal intensity in their tactile firmitis. There's good skin turgor. There's no signs of lesions or masses, and the temperature of the body is even throughout. So now I'm gonna go ahead and I'm so sorry. I'm gonna need you to turn back around. I'm gonna go ahead and I'm gonna do the percussions on the Renaissance. So can you just turn this way? Thank you. So this is 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. Okay, so the Renaissance is heard, and there is a low pitched and hollow sound. The next thing that I will be going ahead and doing is I'm going to be auscultating. Okay, so I'm going to take my stethoscope. Okay, so I will be listening to 2 sounds, and I'm going to be pointing towards the rest. So breathe in. Good. Breathe out. Breathe in. Breathe out. Okay, so 1, 1, 2, 2, 3, 3. Okay, and can you just turn around for me? I'm going to go ahead and auscultate the anterior chest. 1. Okay, so after auscultating, I can see that your rate is 15 breaths per minute. There's no sounds of crackling or wheezing sounds. The quality of your respiration was smooth, effortless, and even. And there's a healthy heart sound. Also, I would like to mention that your ATP ratio is also 1 to 2, so that is also normal in the human findings. So now we're going to go ahead and start with the cardiovascular. So I'm going to go ahead and auscultate your cardiovascular. So starting with the manubrium down to the second intercostal, which is your aortic valve. Then we're going to go to your pulmonic. Right below pulmonic is Erb's point. Then we have the tricuspid valve, and then we have the mitral apical valve. So that's a valve. And in terms of the S ones that are effectively heard are basically the apex, which is in between the tricuspid and the mitral valve, and then the S2 sounds are effectively heard in the aortic valve. Your rate is 75 beats per minute, and your and there is respiratory rate is 75 beats per minute. There's a healthy lub-dub sound. There is no extra heart sounds indicating like a murmur or no abnormalities, which is good. So other than that, Dan, I think you are good to go, and this is your physical assessment.
Thank you.
10 minutes.